Deepseek took the entire world by a storm. Billions, if not trillions, of US dollars were wiped out of the US stock market because of this new application that is a competitor to chatgpt by OpenAI. Today, I'll be asking it some questions and assessing the quality and the responses that it has in the context of dentistry, and in particular in the context of wisdom teeth. My name is Dr. Mo, and I'm a licensed general dentist. First question I'm gonna ask it is it actually necessary to always remove wisdom teeth? This is an extremely popular question, and a lot of people get it wrong. Let's see what Deepseek has to say. Is it necessary to always remove wisdom teeth? Oh, I'm actually surprised with its first answer. So it does say it's not always necessary to remove wisdom teeth, and goes on to mention what are the sort of like indications actually for the removal of wisdom teeth. I'm actually very surprised in a positive way about this response. So, according to Deepseek, it is not always necessary to remove wisdom teeth, which are third molars, right? We have 3 molars in each quadrant or fourth of your mouth. 3 here, 3 down, and 3. Whether or not to remove them depends on several factors, including their position, whether your third molar is erupting or coming into the mouth in a correct position or an incorrect position that may cause harm or complications on your oral health. Their alignment, as we said, is it misaligned? Is it aligned properly with the rest of your teeth and rest of your molars? And impact on oral health. Is this wisdom tooth or third molar, is it infected? Is it sound? Does it have deep decay or caries? All of these things significantly impact the decision of the dentist or the clinician in terms of, should I remove this wisdom tooth or should I remove it? Should I keep it? So the first thing it mentions is impaction. Impaction is when the wisdom tooth is coming in an inappropriate position. So it could be erupting horizontally instead of erupting vertically, and when it comes horizontally it may be pushing on the adjacent tooth, and we call that impaction, a horizontally impacted wisdom tooth. At the same time also, that wisdom tooth may not have adequate space in the jaw or the mouth to erupt, and we call that also an impacted third molar. There's also misalignment, as we said, if they're growing at the wrong angle. There's also infection or decay. Now, generally speaking, if another tooth is infected or it has deep decay, then we could look at options or to treat that tooth. Unfortunately, for wisdom teeth, they are difficult to treat, say using a root canal or other methods of treatments, because number one, it's one of the teeth that has very high variety when it comes to the mouth, meaning the wisdom tooth you have, I'm pretty sure it's like very different from your friend, very different from your family member. It's one of these teeth that has a lot of variation in the crown and the root and in the way that it erupts, even the number of wisdom teeth that you may have. Not all people have 4 wisdom teeth. That's normally what you're supposed to have, like 1 on each quadrant, we call them. This is a quadrant. This is a quadrant. Then we have a quadrant down here and a quadrant on the left. 4 quadrants. Some people have all 4. Some people have more than 4. Some people have less. Some people have none. Okay, so there's a lot of variation. Cysts or tumors. One of the most common cysts in relation to the wisdom teeth is called a dentigerous cyst. I'm gonna actually quiz Deepseek if it knows what a dentigerous cyst is, and if it's possible to even may show us some visuals. What is a dentigerous cyst? And I'll be elaborating afterwards. Just want to see its response. So basically, dentigerous cyst normally occurs on top of a tooth that's trying to erupt or come into the mouth, but it will be like sort of attached to the top of it, kind of preventing it from coming. There are, of course, all sorts of other cysts or tumors that can be possibly associated with the eruption of the tooth, let alone your wisdom tooth. Pain or discomfort. We have to address if a patient's coming with a lot of pain and discomfort in relation to their wisdom tooth, and as you can see, it sort of suggests, well, removal may be recommended, of course, after thorough assessment and evaluation of the individual case. Let's see now if it knows what is a dentigerous cyst and can it be related to a wisdom tooth. Oh, what is a dentigerous cyst, and can it happen in relation to a wisdom tooth? Okay. So far, I've only asked one question, but okay. So it's addressing the question in 2 parts, and I like that too, and it's giving really decent details. We'll go over them once it finishes with its answer. Now, one of the issues that I have with these AI, even ChatGPT and Deepseek, is that they go on and on and on, and like it's still answering. Just ask a very simple question: ask what is it, and can it be occurring in relation to wisdom tooth? It goes to write a whole essay. I mean, that is just small criticism. So I asked, what is a dentigerous cyst, and can it happen in relation to a wisdom tooth? A dentigerous cyst is a type of a benign, non-cancerous cyst, so that forms around the crown of an unerupted or partially erupted tooth. Mind you, just a bit ago, I said some of the teeth are trying to erupt, especially third molars and canines, are somewhat common to have a dentigerous cyst. So it tells you how it develop, and then it tells you in particular where is it common in relation to the wisdom teeth and the canines. Okay, so far so good. Can it happen in relation to a wisdom tooth? We just mentioned it could, especially an impacted one, where it mentions, it clarifies impacted as in stuck in the jawbone or gums and unable to fully erupt. Is giving characteristics of a dentigerous cyst. I mean, it's just elaborating furthermore about it. Just asked a very specific question, and some risks: bone destruction. So dentigerous cyst could slowly but surely grow and in size, and it mostly can be identified through orthopanthogrammic, which is like OPG X-ray, this X-ray that they take for all of your teeth in order to identify, or at least some form of early diagnosis, that there's something that we can suspect in the third molar region. We need to do some further assessment, and should be seen by an oral surgeon at least, or an oral maxillofacial surgeon, to do proper evaluation assessment, even conducting the treatment for such case. So they talk about the treatment options, whether you should surgically remove it, biopsy, and due to significant bone loss, may consider a bone graft into that area. And as we said, they look at the prevention. They're like regular dental checkups and x-rays can detect such potential abnormalities in the area. I don't like to get to a direct definitive diagnosis through just an x-ray. I mean, it should be a combination of like clinical examination, x-ray evaluation, history taking. It's just a lot of factors comes into diagnosis. Wouldn't rely on just one individual like issue. So another thing I would ask it is, I'll just I ask it to a bit of questions. I'll give it a simple question. I'll say, what are the instructions following the extraction of a wisdom tooth? Now, keep mind you, most of them would be applicable to the extraction of any other tooth. What are the post-operative instructions after the extraction of a wisdom tooth? This is more of a like a bit surface, much more simpler question, of course, so I expected to know. Now Deepseek is my student. I'm like evaluating, is it gonna do good this time? Right, so it categorizes them. It's like bleeding control, swelling management, pain management. I like this also. I mean, of course, I'll dig into the details of each of these, but on the surface, it looks good. So bleeding control, bite on guys, the takeaway here, just wrote a lot of stuff, is that pressure would help control the bleeding and reduce the bleeding, right? And then the gauze is normally given by your dentist or clinic or dental assistant. Avoid spitting or rinsing, extremely crucial. If you don't avoid spitting or rinsing, this may contribute to dry socket. It can dislodge the blood clot. Secondly, we get into swelling management. So it mentions cold compress. If you watch some of my videos, whether shorts or long formats, you'll see that I talked about using cold compressions in order to alleviate some of that swelling and keep your head elevated with pillows when laying down to minimize swelling. Can anybody guess in the comment section, why do we do this? Why do you elevate your head when laying down? Because when you lay down in a particular position that is not elevated, that may cause an additional or increase even blood flow, which may think is good. I mean, it's fine, but the thing is, that may not help with the management of your swelling. In that swelling, there's also a lot of fluids and blood. So when you elevate your head, that helps to minimize the swelling. Then we have the pain management. Of course, there's medications. I don't like that it mentions particular drugs and tells you to avoid or not avoid. I mean, it's not the AI's job, in my opinion, to mention select individual. Like it just said this, the avoid aspirin, right? The problem is some people may be prescribed by their physician or attending doctor to be taking an aspirin. So it is in no position as bad AI, as an AI, to tell you stop taking X or Y or Z medication without it consult with your attending physician and whoever that prescribed aspirin to you. So there is a minus point on this. Should not be saying avoid this medication or even take that medication. So this is very, like, look, so far it was so good, but then it just hits with, like, this is a big one. I mean, some people could be critical, like we say. Even there's recent guidelines that are in recent publications that are talking about, well, is it actually even necessary to stop aspirin for some individuals where like blood tests were done? Is it even necessary to stop the aspirin dose? Of course, with consultants. thing done with their attending physician prior to an extraction. And some of them say, well, actually may not be that necessary. Why are we stopping the aspirin beforehand? Of course, the dentist does not tell you like stop or do, or they have to consult with your attending physician and whoever doctor that prescribed X, Y, and Z. I'm just giving an example with aspirin before doing any step. So this will cause a lot of legal issues if it's saying avoid or stop this drug or do that drug. I mean, it's in no position to say this. I just said one wrong sentence and went ham on it. So we have the diet. If they're recommending soft foods, it's fine. Avoid hot foods and drinks. True. Avoid hard or crunchy foods 100%. Stay hydrated. All of this is completely fine. I mean, we have oral hygiene. There's a note here, very important point, that it says after the first 24 hours, because at the beginning you're not supposed to rinse. Why? Because as we said, that rinse or spitting of even water or warm water may dislodge that blood clot and put you at a higher risk for dry socket. I have videos on dry socket. What is it? Extremely painful condition. Trust me, you do not want to have a dry socket. Yeah, just some hygiene instructions. Activity restrictions is not to be taken as a joke, should be taken seriously. You must rest and avoid some vigorous exercise or all of these things. And also another part of this is no smoking or alcohol. This is extremely critical. Please follow this. I mean, at minimum for the first week, I would even advocate beyond this. I mean, it is like disastrous the effect of smoking or alcohol could have on the healing of an extraction site. What for complications? I mean, please do not like wait and let things happen and develop and get worse. If you're noticing some issues like pain, a fever, swelling, pus, it's literally telling you like seek medical attention. And normally we tell that like almost always in the post operative instructions. Now there's numbness. Note that they said numbness in the lip, tongue, or chin which persists. Now, is it normal for the lip, tongue, and chin to be numb directly following an extraction? Of course, it is normal, especially if you had an extraction in the lower, like posterior or molar area, like say removal of wisdom tooth, because the dentist who anesthetizes that tooth, unfortunately, the way that they give the anesthesia is called inferior alveolar nerve block, and they anesthetize other nerves in the region like the buccal nerve and other nerves in that area, and that is essentially done as part of you having a painless or at least as minimal pain and suffering during the removal of your wisdom tooth. That being said, this anesthesia depends on what type of anesthetic they use. There are short-term, intermediate-term, and long-term anesthetics that are used, but it should never you should never be having this numbness beyond a day. If you have this, or if you have some tingling sensation, you could seek you should follow up with your dentist because there's a lot of reasons that may have caused this. I mean, shouldn't jump to directly nerve damage, but there's a lot of things that we may think about when that occurs. Follow up with your dentist and attending physician, very important. I mean, timeline of recovery, I mean, it's fine, they're just giving some general, but I wouldn't give specific like days or weeks, or because every individual is different. Some people are gonna heal rather quickly, some people are gonna suffer for a long time. Anyways, that's all for today. If you like this format, please like the video, share it with your friends, make sure to comment. I mean, I enjoyed this, to be fully honest. I was surprised in a good and a bit of a bad way, and some things that we noted out here. Thank you very